advisors and their substitutes. I'll now hand you over to Mrs. Dunsmuir, who will take us through the housekeeping. Thank you.
Thank you, Convener. Before we begin, as the Convener says, I'll take you through some housekeeping. Aberdeen City Council has a no smoking policy. And you're requested to refrain from smoking at all times whilst in the building. In the event of a fire or other emergency requiring evacuation, we'll hear a continuous single-tone klaxon, and we should proceed immediately out of the building via the designated exit route, which is out via the door through which we entered, head back to the main staircase and down to the ground floor. On exiting the building, we should proceed to the Arts Centre in Queen Street, where we'll wait until clearance is given to return to the building. The closest toilets are located in the corridor behind the lifts of the main stairwell, and it would be appreciated if mobile phones could either be switched off or put on silent mode. For anyone with hearing difficulties, there's a hearing loop system in this room linked to the sound system if you wish to put your hearing into T position. So this is a hybrid meeting with some people in the chamber and others participating remotely. Today's meeting is being recorded rather than webcast. Could I ask that all attendees switch off their camera and mute their microphone when not speaking, but that you switch on both your camera and microphone when you're invited to speak so that this is picked up on the recording. That's for remote attendees. If those at home wish to speak, could I ask that you please either use the raise hand function or indicate in the meeting chat. If you're having any issues with either of these, please just activate your camera and signal that you wish to speak. For those in the chamber, could I ask that you use the microphone when speaking on the desk and also ensure that you speak directly into it so that you're clear to those at home and for the recording. Could I also ask that if you have a laptop with you, that you turn on your camera in Teams when you're speaking so that those at home can see you, but keep your volume and your speakers in Teams turned off. I'll now just take a quick roll call and would ask that members confirm their attendance when I call their name so that this is clear in the recording of the meeting and can also be recorded for the minute. Convener?
Yep.
Vice Convener?
Present.
Councillor Blake?
Present.
Lord Provost?
Present.
Deputy Provost?
Present.
Councillor Fairfull?
Present.
Councillor Graham? Councillor MacDonald?
Here.
Councillor McGregor?
Here.
Councillor Mackenzie? Councillor MacLeod? Councillor Meny?
Here.
Councillor Thompson?
Present.
And just the trade union advisors, Mr. Willis?
Here.
Mr. Masson?
Here.
Mr. Musk?
Here.
Ms. Robertson?
Here.
Apologies from Mr. Curry from the SSTA. Ms. Thorpe?
Here.
Mr. Constable?
Present.
Ms. Gray?
Apologies from Michelle.
Thank you. Ms. Sales?
Here.
And Mr. Craig?
Present.
Thank you, Convener.
Thank you, Mrs. Dunsmuir. We'll get on with it. Business then. So notification of urgent business, there is none. Determination of exempt business, there's nothing. 3.1 Declaration of Interests and Transparency Statements. Have we got any? I'm not seeing any. I'm not seeing anything. Oh, Councillor MacDonald.
Thank you very much, Convener. I think just at the beginning, since this is a new term, I would like to declare that I am a member of Unite the Union, but I don't feel that I need to say it at every meeting and just put that on record now. Thank you.
Thank you for that. Councillor Thompson.
Hi, like Councillor MacDonald, I'm also a member of a trade union. I'm a member of Unison, so just declaring that for transparency. Thank you.
Thank you very much. Okay, moving on. Deputations we have done. 5.1 minutes of the previous meeting for the 21st of February. It's pages 5 to 8 in your pack. Can we agree the minute or any questions regarding the minute? Okay, I'll take that as agreement. Thank you very much. Next, 6.1 Committee Planner. Any questions on the planner? Councillor MacDonald.
Thanks very much, convener. And really, it was just to ask, first of all, just a general question around number 12, where we've still to be confirmed what the purpose of the report is. And I think it would just be helpful as we go forward, you know, to have those boxes and the terms of reference and so on in the report in front of us for members. So both at number 12, convener, and also the annual committee effectiveness report. And there may be reasons why these things are still to be confirmed, but it'd be good to hear from officers. Thanks.
Thank you, convener. I'm happy to note that from Councillor MacDonald, and we can circulate something which updates as to the missing boxes that are there today, if that would be helpful.
Very helpful, thank you.
Anything else? Councillor Thompson?
Thank you, convener. I'm looking at number 8, the workforce strategy, and it says it's been delayed and it will be presented to committee after August. I just wonder if there's any further detail about when that might be coming to committee. Thank you.
Mrs. Newcombe?
Thank you, convener. There is a staff governance committee, as you'll be aware, in October. It would be aimed to be presented at October. We do need to see anything that's coming out of the full council meeting in August that may have an impact on the strategy and to take effect of that. So I didn't want to put that it would be October and then have you disappointed, but that would certainly be our aim.
That's great. Thank you very much.
Thank you for that. Thank you, Mr. Newcombe. Right, moving on. Oh, sorry, anybody else?
Thank you, convener. I just wanted, following on from that question, to really ask if it's worth and maybe sharing from a previous report or the service update that we had on workforce, just to get members of this committee perhaps up to speed of where we were, certainly up until maybe I think it was around February. Well, I can't remember the exact date we got the service update, but that might be useful just to help members in that journey, because you know, I take on board what's being said about changes that might be come into effect from other committees, but I think for this committee, just keeping abreast of that would be incredibly helpful.
Thank you, convener. I think that would be really helpful. We could certainly recirculate the service update that went earlier in the year. We are also looking to implement some training for the committee, recognising that there are new members of the committee, and I would welcome any feedback as to areas where committee members would appreciate further briefing or information ahead of that training, and we can certainly incorporate that or circulate information in advance as well.
Thank you for that. Is that everything? Okay, so can we approve the plan? Thank you. Right, moving on. Notices of motion. There are none. Referrals from council committees and subcommittees. We've no referrals at this moment, which brings us on to today's agenda, health, safety and wellbeing of staff 9.1. It's the corporate health and safety quarterly update, January to March. Mr. Lever, any questions for Mr. Lever? Councillor Blake.
Thank you, convener. I was interested in terms or in item 3.15. It noted that the majority of near misses are in an education setting resulting from distressed behaviour from some children. I'm interested in knowing what type of training and support is given to both staff and the pupils to reduce reoccurrence.
Yeah, so good afternoon, Councillor Blake. I'm trying to find within the report the notes that says what has actually been done, if you bear with me a second. So there's a community-based training programme which identifies the issues with the children, and looks at how we can improve that behaviour. That's on the long term. And short term, there is a training programme in place which actually allows staff to identify the triggers that they see that lead up to these incidents, and also how to remove themselves from any incidents that there are, or how to reduce the risk of them being harmed during those incidents.
Thank you. Can I ask another question? It's on a similar note. I note on page 25, so that was in the main kind of appendix bit of the report, there was a significant increase in incidents caused by unacceptable behaviour in 2021-22, up to 195. And that was noticeable in comparison to the previous 2 years. So I was wondering, but obviously those would have been impacted by the pandemic, where kids, pupils would have been out of school quite a long period of time. So I was interested instead, what's the comparison with 2018-19, which would have been the last full year of school, to make that comparison?
I think you're correct in the fact that the figures were reduced in the previous 2 full years down to the effect of the pandemic, when large amounts of the school year weren't done face-to-face with pupils, or with the majority of pupils. So we've suspected that as these we return to more full schooling, that the incidents would return to more what would be the average, and possibly, given the amount of distress that has caused pupils whilst being away from education, the chances are there might even be a spike at that point. As to figures for the prior year, yeah, we could easily do that. That was the case. We were asked for it in one of the previous committee meetings, and we did do that, but because we've moved past the year 2018-19 as a 3-year comparison, it's dropped off the end. So what I'll do is I'll make it a 4-year comparison, so you've got that pre-pandemic full year as well. I can share it with the group for this quarter out with the meeting, and then from going forward I'll include them in.
Thank you very much.
Thank you. Thank you for that, Mr. Lever. Anybody else? Councillor MacDonald.
Thank you, convener. I'd like to draw your attention to the Ridder reportable incidents, and in the text at 3.7 it mentions 6. When I was looking at the graphs, I noted that in fact I could only make out 5 on page 23, but so you know, that just to flag that up perhaps. But I'd also said in the 3-year comparison under 3.16 that there's now starting to see an increase in reporting, which and I don't know if that was more for the other reporting elements rather than just Ridder, but Ridder does seem to be fairly you know, it's the same actually from year to year. There's not really a big difference. So just to ask if that is the case, because of course Ridder ones are ones that do need to have that extra attention put on them, both by ourselves and by HSE.
Thank you. I'll check. Sorry, convener. I'll check the figures because I've just checked and it does look as if it's 5 and we've reported 6, and it may just be an error of me putting 6 into, not changing the figure from 5 to 6. So my apologies if that's the case, and I'll confirm it. What my team do for Ridder incidents is, because they are deemed to be the ones where we've got to pay particular, so we pay scrutiny to Ridder incidents and trends of incidents. So for Ridder incidents, we'll get in touch with the manager of the person who suffered the incident. We'll get them to check. We'll check that they've identified the true root cause. So what's really the reason behind it? And we'll check that they've put controls in place that will help to reduce the likelihood of that happening again, where those controls are possible. And you're right, they do seem to stay fairly steady. And the majority of them tend to be for incidents where people are off for 7 days or more, which is a RIDDOR reportable occasion. So for instance, one I was looking at today was somebody tripped over a tree root and sprained their ankle, and that keeps them off for 7 days. So not belittling it, but not a serious incident, and very little we can do to put a control in place for that, to be perfectly honest. But yeah, that tends to be the main level incidents. We notice that slips and trips are a reason for these over 7 day incidents, and manual handling's another reason. So in the services where that's a greater risk of happening, we're actually doing compliance checks on their processes and individual compliance checks on them both as well, to try and find a way to reduce those levels. Hopefully it works, but a lot of it is down to you know, slips and trips, watching where you're standing and all that sort of stuff when you're busy doing your work. Did that answer your question? Sorry.
Yes, thank you very much, Lever, that Mr. Lever, that did. I do have another question, convener. It's at 3.20, and it's about the overall average compliance and fire risk assessments being 88%. And I just wondered if that was poor, good, very good, excellent. I'm just not sure, and just to get some wider commentary around that. Thank you.
Mr. Lever.
Yeah, it can depend. So we go through a British standard process called PAS 79. Don't ask me what PAS stands for because I can never remember. And it goes through a set series of topics. So it can, and what we do is when we identify an issue, we raise it with a time limit for it to be sorted. With the most serious being within the next day. So if it's something really serious, we get it within the next day, then within a 3-month period, then within a 6-month period, and finally it's just a recommendation for best practice when you next refurbish a building, for instance. So we keep a spreadsheet of all of these actions, and every Friday morning my team check to make sure that they're all up to date and being complied with. We're in the process of looking at a way of showing you compliance on outstanding actions, which is probably a more effective way for you to gauge whether the system's working correctly. But that 88% can vary between a fire door being damaged to somebody not having put a particular line of text in their fire evacuation plan. So they do it, but their paperwork doesn't reflect what they're actually doing. And historically, we found that when the enforcement authorities, Scottish Fire and Rescue, HSE, come in, they'll hold you on what you've written rather than sometimes what you're doing. So you can be held to account for that. So they can be minor and they can be major, but where they're major, they're dealt with very quickly. And those are the ones we can be 100% sure on, they're really effectively and quickly dealt with because they are a real risk to life.
Thank you for that, Mr. Lever. Any other questions? I have Alison Robertson. Ms. Robertson.
Thanks, convener. Yeah, this is really, sorry, page 23 of the health and safety incidents states that the distress behaviour incidents often involve children and young people where a social, emotional, mental health need has been identified. My question is that we know from operations, health and safety committees, it's not always people with an emotional need or a support need that the incidents are occurring. What training has been given to staff to deal with pupils that don't have emotional needs, and what's happening with it? You know, what's the what happens with the pupil as well to safeguard the teacher?
Mr. Lever?
Yeah, to be perfectly honest, because the majority of incidents happen around the children with special support needs, that's tended to be where I've focused and have a greater understanding of. So what I'll have to do is go to education, ask them to give me what training the staff get. I'd imagine that part of the teacher training programme would be for them to know how to deal with misbehaving pupils. But we need to look at, and I need to look at and find out what else we're doing on top of that to make sure that those skills are kept up to date and refreshed. So
Could
I
I-
need to go back.
Thanks,
stop-
Mr. Lee. Sorry.
Sorry, can I stop with that, Mr. Lever? Thank you very much for that. Would it help if we got Mrs. Shepherd maybe to give us a note about what's happening and get it circulated to the members?
That's
And the-
what. Sorry,
and the
convener.
union.
That's what I was planning to go to Mrs. Shepherd and ask her to confirm what they did, so that I'd be able to. So if you're happy, I can get that information from Mrs. Shepherd and give it to you.
Thank you, Mr. Lever. Can I also ask, of the incidents, is there any particular schools that's showing up as being problematic, or is it just across the board?
Can I stop you there, Mr. Lever? Let's get in more into the realms of operational stuff. Can we leave
Okay.
that for Mrs. Shepherd, if you don't mind?
Thank you.
Was there anything else you wanted to ask?
No, that's fine. Thank you, convener. Thanks, Mr. Lever.
Anything else? Anybody else? Can we note the report then? Thank you.
Thank you.
Right, moving on. 9.2, naloxone project update. I believe Mrs. Foley, you want to say a few words before we go to questions?
Yes, thank you, convener. I just wondered if it might be helpful for new members to have a bit more of the background to where this piece of work came from. So I just thought I'd give it a quick summary, which might also answer any questions that people might have. So really, we started this really grew out of the rollout of the national naloxone programme that started back in 2011. And we then, following the announcement from the Lord Advocate in June 2020 that there would be a relaxation around the distribution of naloxone, we started working with the Alcohol and Drug Partnership in Aberdeen to start looking at how we could roll out distribution and administration of naloxone across the city. And those people who were on committee last year will recall that we brought a report to committee back in April of 2021, just asking for approval to go ahead with this piece of work. So since that time, we've been working really hard with the Drug and Alcohol Partnership in Aberdeen to provide another route so that this life-saving drug can actually get out into the hands of those people in our communities whose lives might and will depend on getting hold of naloxone. And there were a number of things we had to do to become a corporate distributor of naloxone. So we had to make sure we had policies and procedures in place. We had to make sure that we had appropriate support for employees who were administering and distributing naloxone. And obviously we had to make sure we had the correct training in place. So I'm glad to say that in April of this year, the Aberdeen Drug and Alcohol Partnership confirmed that we had achieved everything that needed to be achieved. Our policies and procedures were deemed appropriate, and we were therefore recognised as a corporate distributor of naloxone for the city of Aberdeen. And our understanding is that we're actually the first Scottish local authority to have been recognised in this way. However, probably the most important bit now is, what are we going to do to build on that? You know, what are the next steps here? So really, the part of the main reason of bringing this report is, yes, to provide an update, but also to set out what we're planning to do next. We're planning to really be targeting, you'll see in the report, we've identified the 5 areas of the city where they currently have the highest instances of reported drug deaths. So we will be really emphasising in these areas. We're looking at getting more teams trained in the administration and distribution. We're looking at having libraries and community centres in particular as distribution points where people in the communities know they can go and pick up a kit of naloxone if they would find it helpful to have something, so that it's just making it as easy for people to access this drug as it possibly can be. So we've had great support, not only from the elected members throughout this work, but also very much from the trade unions who have worked with us every step of the way in supporting the employees to do this. So if anyone has any questions based on the report, I'm happy to answer them if I can.
Thank you for that, Mrs. Foley. Any questions for Mrs. Foley? Councillor MacDonald.
I'm finding it hard to coordinate this camera and speaking malarkey, but I'm getting there. Thank you very much, convener. I was one of those who took part in training in March, way back, gosh, I can't remember if it was 2021 or 2022 now, 2021 I think it was, and we had an hour and a half where we were effectively able to then administer naloxone. So I didn't see it in the report, and I think, you know, just to put it on record that elected members have taken a part in that, have been trained in it. And I suppose my question is around how long does that training, because I haven't had to use it, thankfully, my training, but it would be good to get some sort of refresher, or even for new members who might want to take up an offer of getting trained in administering naloxone might be something that new members want to do. So that was my first question. My second one was around the next steps, convener, around the coordinator who is now in place. And I just wanted to check that, you know, or just ask really if this is a new position that has been funded for, I'm assuming it's Aberdeen Drugs and Alcohol Partnership.
Mrs. Foley, can you answer this?
Yes, thank you, convener. I can. That's an excellent point. Thank you, councillor, about the you know, about refresher training. To be perfectly honest, I'm not sure how long the training does last for. So that's a really good point, and that's something I need to go away and find out. So thank you for that prompt, and I'll go and do that, and I can then circulate the response to that. We are still rolling out the training. Any members who have not undertaken training and would like to do so, or who would welcome a refresher, are more than welcome to join that. If you just send me a list of names, I'm more than happy to get that in place, and that would be very, very welcome. I'm sorry, Councillor MacDonald, I've forgotten what your second question was.
Yeah, no problem at all. It was around the coordinator post that's now in place to monitor the process?
Yes. This actually is a post within Aberdeen City Councillor, within Aberdeen City Councillor MacDonald, and it's not a new post. This is actually, we already had some of the homeless units were already distributors of naloxone. So the individual who takes on that role for the housing unit has taken on that role, has just widened that remit across the whole of the council. We will continue to monitor that to see if the, you know, to make sure that the workload doesn't become too big, and to see if we might need to make any changes to that. But for the moment, it's working well having that same individual, so that we've got a single point of contact with Aberdeen Drug and Alcohol Partnership, who's collating everything and has the access to the Neo 360 database, etc.
Thanks very much for clearing that up with myself. And so I'm assuming from that that's not a full-time post. That's somebody that's taken that on board, which is what Ms. Foley said. Can I ask convener as well? I wasn't sure what the accommodation unit was under 3.15. So just to ask on that, and also just to ask about the webinar at 3.18 and how widely that's going to be. It says service managers, and will that be rolling out even further?
Yes, thank you, councillor. The accommodation unit is the homelessness unit in West North Street. So that's what that refers to when it refers to the accommodation unit. The webinar was initially rolled out to the leadership forum. However, it was recorded, and the recording is available for anybody who wishes to watch it to pick that up and watch it again.
Thank you, that's helpful.
Anybody else want to ask questions? Deputy Provost.
Thank you, convener. Apologies, my camera's not working just now. First of all, I was looking at the graph, and unless I'm misunderstanding, it's seeing count of incidents. I'm assuming that would be incidents where the naloxone, if I've got the pronunciation right, was actually administered. That's my first question.
Thank you, Deputy Lord Provost. Is this the graph on page 35 that you're referring
yes, it is.
to?
Thank you.
Actually, no, Councillor. Sorry, Deputy Lord Provost. This is actually showing the number of drug-related deaths in each of the areas. So this is the graph that we used to identify the 5 key target areas for the next steps. So the period shown is the drug-related deaths in each of the areas between January 21 and December 21.
That's particularly helpful, although particularly sad as well to see the numbers
Absolutely.
as high. Do you have any figures as to what sort of difference the running the project has made? I know it's obviously made a lot of difference, but do you have figures on that?
At this stage, we don't as yet, because we're recently been added into the Neo 360, which is the database. We don't have all that data available to us yet. But now that we are an approved distributor, we will have access to that report. So we will be able to report back to staff governance on an ongoing basis if that's what the committee would find helpful, so that we can continue to monitor the effectiveness of the initiative.
Thank you very much.
Thank you, Mrs. Foley. Anybody else? I've got one for you following on from Councillor Delaney. Do we know if any council staff have actually administered naloxone in the last 12 months?
As yet, no, they haven't. They haven't been in a position where they've required to do that. But you know, at least we can be sure that if they did find themselves in that position, they have the kits available to them now, and they would be able to do so. I think that probably rather than the actual administration, one of the biggest roles we're going to have as a local authority is around being distribution points, so that people can pick up kits, so that they have them for self-administration. And we would also be hoping that other organisations across the city will follow our lead and also train their staff as to distribute naloxone. And we would be happy to work with any other partnership organisations who would be keen to take that role on.
Thank you very much for that. It's quite heartening to know that the staff haven't had to use it. Anything else? Okay, can we agree to report recommendations? Thank you. Can I also say a big thank you to our union representatives and union members for buying into this and lending their support is much appreciated. Thank you.
Thank you, Convener.
Right, moving on. 10.1, the cluster risk register. Mrs. Newfoundland, I believe you want to say something.
Thank you, Convener. Like Councillor MacDonald, I'm just going to put my camera on 1 second. Thank you. I just wanted to introduce the report briefly and just make a clarification. This report focuses on the risk register for the cluster, which means that it's focused on risks to service delivery of people and OD cluster. We do, as you'll see, also have a corporate risk, which is around workforce capability and capacity. Because that's a corporate risk, that is reported into Audit Risk and Scrutiny Committee, and so went earlier in the year. The assurance map, which is also attached to this report, then covers the assurance for both the corporate risk, if you like, and the cluster service delivery risk. So just if you were looking at that and wondering the difference between them, I just wanted to make that clarification. Otherwise, happy to take any questions.
Thank you for that, Mrs. Newcombe. Any questions from Mrs. Newcombe? Are we happy to agree to report? Thank you very much. You got off lightly there. Right, moving on. 11.1. Appeals Subcommittee appointment of members. The report's in front. Any questions? Okay, the recommendations on this one at 2.1. I have a small amendment to the recommendations, which is recommendation 2.1 as is. We're adding on 2.2. Note that training is to be provided for members of the Appeals Subcommittee, and agree that an invitation to the training is extended to our trade union representatives. Can we agree that trade unions are invited to the same training as the members? Anybody want to say anything about trade unions or anything? Right, so that's
I-
agreed.
Sorry, convener, I would just agree with that. I would like to go on that training as well. Thank you for the unison side.
Thank you for that. I'm
Thank
sure
you.
Mrs. Newcombe will make sure that when the training's arranged, invites will be sent out. Councillor MacDonald.
Thank you, convener. I'm not sure if it is mandatory, but I think it should be. I think anybody who hasn't been on the training, really should go on that training to make sure that we discharge our responsibilities fairly on that. And I just wondered, for those of us who are returning, whether there's something that could be helpful, but maybe we don't need the full training that other new members might be. So it's just to factor that in if possible.
Do you want to say anything, Mrs. Newcombe? I'm sorry. It's my understanding that all members of this committee are also members of the subcommittee and are required to undergo the training before they can hear any appeal. So for that respect, it is mandatory for elected members if you're going to hear appeals. This amendment is basically invited the trade unions to send their reps along at the same time, so they know what we're being trained, and which will complement the training, and they give their own members as well. And in effect, we'll all be singing off the same hymn sheet, and we'll all know what everybody else is doing, and we should all know what we're all doing. So for that case, it can only help things. So I do appreciate your support for the amendment. Thank you. Anything else? Well, that's the end of the meeting. Thank you very much for your attendance.